you see the effects of this. It's not just your quality of life, but the quality of care that's being provided to patients.
Speaking of being nice, I think that's a good tie-in with provider burnout. You're pretty young. I don't know if you've told people how young you are yet, but how would you assess how to avoid provider burnout? I feel like we have very low provider burnout at Gillett Health, but maybe it just hasn't been around for long enough. But there's certainly some things that can help and some things that can hinder this, ability to be nice. If you look at a chart, this is probably true for nursing school as well, but during medical school, you have very high levels of empathy. There's a scale that you can measure it. And then as you go through medical school and residency, it plummets precipitously.
Yeah, and you see the effects of this. It's not just your quality of life, but the quality of care that's being provided to patients. I saw an article, and this has probably been a couple of years ago, that caught my attention, where you had this individual who was seeking care in an emergency department and inner city somewhere. The nurses or whoever's doing triage just assumed that they were intoxicated, whatever it may be. They need to sleep it off, and they were actually in diabetic ketoacidosis. So you never want to kind of frame a person in your mind based on your past experiences, because everyone is a unique individual, and that's why we're such big proponents of individualized medicine. So I think that's a big part of it. And burnout, the electronic health record systems, it's not all that it was cracked up to be initially. I think it is better than the paper charting in terms of having things being organized, being able to find files, fax reports, things like that. There is a lot of good about it. But there is a correlation with the alert burden and reminders and the number of tasks that providers and nurses have to do in those systems that directly correlates with the burnout. So it's just kind of stuffing more productivity is what they would call it in the hospital system, which in truth it is, because people are being more productive, but you're pushing that into a smaller time window, and that does stress people out. It's kind of like the phenomena of alarm fatigue. You have these bed alarms or cardiac alarms, all these things going off in the hospital. It's like 90 to 95% of the time, because they've done these studies, those are false alarms. So after a while, if somebody is becoming jaded or burnt out, they're not going to respond as quickly to those alarms, even though there's that potential for every single one of those to be a life-threatening situation. That people kind of become desensitized to it. And you see the same thing in the electronic health records. So you get these alerts that pop up, and they're trying to improve quality of care, or reporting metrics, or remind you of things that you need to do. And I'm sure our colleague Taylor has a lot of input on which one of these are beneficial and which are not so much. But they're trying to do a good thing, and people just kind of become desensitized to it. So I think that's a factor of burnout. And then another thing is, we could talk about the corporate takeover of some of these health systems, physicians, providers that were in these private practices that then are trying to have productivity improved, and you're pushing more patients into a smaller amount of time. So productivity does go up. These providers are seeing more patients after a corporate takeover versus when they're in private practice. But a lot of times for patients, that means less time with the provider that they want to talk to about their health. Because you probably know this from being in the hospital and working in traditional medicine, and as opposed to now, there are patients that they won't tell the whole story to the medical assistant or the RN in the hospital. They want to wait for the doctor or the nurse practitioner or whoever they want to see to give away some of the details of their case. So they may come out of left field with some details. It's like, well, that would have been important to know whenever they got admitted, but for whatever reason, they have a level of comfort with a certain provider and not another. It's kind of radical to think about when you have a total stranger that comes into the clinic and you just expect them to reveal their sort of health concerns, things that are very anxiety provoking, and it's very unnatural. Especially, I think I saw this a lot in the more rural environment. These patients would kind of be in denial that anything was wrong with them. They'd be like, my wife made me come here. I don't know why I'm here. I'm fine. This and that. And
for this CR podcast, the number one thing harming men's health.
And we can throw men under the bus here a little bit, because they do tend to keep everything inside, and they're not actively seeking healthcare in a way that would benefit them long term.
Mhm. Yeah. And part of the answer to that would be men's passive self-harm is not seeking healthcare. So that state of denial. But yeah, I think that's a great summary of a lot of the issues regarding burnout. I do find it interesting how sometimes you make the analogy of like an ape swinging from tree to tree. And before you get all let go of one branch, you want to grab the next branch. So huge corporate systems obviously aren't evil. Most of the time they buy a system, they're buying out a failing system or a system that is losing money. And if that system had gone under, then that community would lose that healthcare and become more of a healthcare desert or become underserved. Hopefully Gillett Health can kind of address that. A lot of healthcare businesses do go out of business due to monetary reasons. So one of the ways I look at it is, and just like you, I did a lot of volunteering as well. And they have FQHCs, and it's great to volunteer at FQHCs and safety net clinics. But just like I guess delving into spirituality a bit, just like mission trips for some people can be like a precipice of the spiritual well-being or self-actualization, you can have those same experiences right there with your patients that you're seeing in your city. So just like a lot of Christians see their city or their church as their mission field, they don't have to go to a different country to do it. I think one way to improve burnout is to see the patient population that is right here in front of us, which we're very thankful that they support our small family-owned business, to support those patients and see them as part of that self-actualization.
Yeah, and that's one of the things. I think there's actually good data to this, not even looking at the the spirituality or just being altruistic, but like people literally tend to feel better and have a sense of meaning when they are doing any kind of charity work. And you don't have to be a medical professional to do that. You can go to a local food bank, and you will see people that are like the most thankful that you've ever seen in your life, because that's part of what I did in my volunteering, because I didn't have medical credentials at the time, but I found ways to volunteer and be involved and benefit the community.
Yeah.